Hello, good afternoon. My name is Mary Mutegi. I'm the program manager here at Health Impact Ohio. This afternoon, we have the pleasure of having Mr. Earl Lawson, who is one of the community health workers that's working for one of our agencies. Welcome.
Yes, good afternoon, Mary. My name is Earl Lawson. I'm the co-founder of the African American Alzheimer's and Wellness Association and also Wellness First. Um, I've been working with the hub for a little over 4 years now, but the organization, as I'm a co-founder, has been in existence for 15 years. I'm happy to be here today.
Thank you. We're glad to have you today. So tell us, what inspired you to become a community health worker?
Well, actually, the inspiration came from my wife, Kim, who's also the co-founder of the organization. She has been in healthcare for many years. My background is in corporate sales, but again, caring for the community is something I learned from her. You know, she's certified in Alzheimer's education. She's also certified as a CHW through the organization, like myself. So it's a matter of growth for me. In sales, you still have to solve problems. Also, as a community health worker, you're solving the people's problems. And my sales training pretty much helped me transition easily into this business as far as listening to people's stories and finding out the needs that they have. And once you find out the needs, it's just a matter of connecting with the proper resources, and hopefully they're successful in elevating their lives to a sustainable level.
Great, great. You've kind of tapped into the next questions I'm going to ask you, but maybe expound on it. How does your background influence the way you work with your clients today?
Well, you know, that was an interesting question, and it took a minute to think about that one. As a young child, I've always been a leader in sports, in school, and so forth. So I've always been able to help people be better. You know what they do, even if it's on the court or on the field, what have you. So moving forward, my college education, you know, is in business, but I took a lot of public education courses and speaking courses. So I was able to stand up in front of 500 people at a young age and speak confidently about the topic. So in this business, you're meeting people for the first time. You have to break the ice and try to get some connection with them so they can open up to you. These are very personal issues that we deal with on a daily basis. Sometimes they're legal, and you have to be very conscious and respective of their situation, you know. But I think I've been pretty successful by pulling some information out of people that they normally wouldn't say to a stranger, which I am. After, you know, several meetings with them, we become sort of friends, associates. And the closer we get, the more information I have, and I can also help them out with some of the things that they may need. It's really interesting. A lot of people are prideful and they don't want to ask for help, you know, and they're embarrassed to ask for help because this could be the first time they're either homeless, lost their job, and they just don't know how to deal with it, you know. But I think being an independent person, a lot of people can speak freely to third parties. And I think that's where my success starts, with being a good listener.
That's great. You know, they say most people don't fear death as much as they fear public speaking. So you having acquired that skill at an early age has really been an advantage to your position. And I think that's what really has helped you, you know, be successful in what you're currently doing.
Yes, I agree.
That's really great. So what is one thing you wish people understood about your work as a community health worker?
Well, I think, we go through the training and we're certified by the state and so forth, but I think everybody can be a community health worker. You know, when I was younger, we didn't call them community health workers, but you know, your neighbor's parents, would look out for you on both sides. You know, if they see you were in trouble, they would tell you to stop doing that and so forth. That's something that I think is going away for the most part because people are so fractured and afraid of their neighbors. But we all could help each other, you know, young and old. And I think that's something that we do now as a profession that society needs because there's so many things going on in the world, mentally, physically, economically. There's always something in life that you're going to have to deal with. And if you have a solution, or at least an outlet or a resource to tap into, the stress is reduced, the stigmas are reduced because you're not the only one going through that situation at the time.
That's right.
There's thousands of people that lose their jobs. There's
Mhm.
thousands of people that are short on money at the end of the month for food. But there's resources, and I have cases where people will do things to supply gifts during Christmas time. That's a lot of pressure on Americans come Christmas. And if you don't have enough money, you have children, the children don't care about that. They want a gift. And in the diversion program where I work with the city of Columbus, there's a lot of people that are under pressure and they take things from retail stores during the Christmas time to satisfy their families and so forth. And they end up in our program, and that's where we help them get that case dismissed from their record.
So, Mr. Lawson, you've been quite successful in closing the behavioral health pathways and with your work with the City of Columbus Diversion Program. Can you share one story that you feel is the most impactful or one where you feel you've really made a difference?
Well, there's many stories over the several years. We've served over 250 clients in the diversion program with the City of Columbus. But one of the things that really stands out for me is this depression and anxiety, bipolar disease that's pretty much rampant. People get depressed and stressed out, and they act out of character. And there's one client that comes to mind that she was a young mother in an abusive situation. And during my interview with her, she was explaining her abuse from her ex-boyfriend at this point, but she had a young child that witnessed that. And obviously I connected them, or her actually, to a healthcare provider for mental health. And not only did the mother go and get assistance, they were able to bring the daughter, who was I think 13 at the time, into the sessions after the mother established a relationship with the counselor, and it helped the child out because they're witnessing these things. And you don't want the child to grow up to think that that's a normal household where the male figure is abusing, whatever, verbal, physical, whatever. That's unacceptable. But again, if I wasn't able to connect the mom and the daughter to this counselor, she might fall into the same trap. And the mother was very grateful that her daughter was able to come. She was doing better in school. She's seen a smile on her face when she was kind of withdrawn for the most part. So all those things help, and that's what makes being a CHW worthwhile. It's those little success stories.
I know, and like you say, there's so many stories you can attest to, but I think the gratification is when you see the success, despite the journey that you've taken to accomplish this.
Yes.
So, we applaud you for the good job, and those small differences are making a big impact in our community.
Thank you.
Yes. So we go back to the one, pandemic that has hit us so hard, and I know it's still with us here. So how has the COVID-19 pandemic changed your role as a community health worker? What work have you done around COVID-19?
Well, first of all, with the social distancing and the highly contagious nature of this pandemic, I remember other so-called pandemics, H1N1, swine flu, and all those, but this one was different. Obviously we were face to face with our meetings with our clients. I would meet them at a neutral place. a library, sometimes at the home. And, there's a synergy there when you meet with someone face to face. Today, like we're meeting on Zoom, it's a
Mhm.
lot of Zoom calls when COVID-19 hit. We had to figure out how to still reach our clients, but not be face to face into the community. So that was one transition to actual interaction with our clients. Second of all, because it was such a different virus, it wasn't like the flu. This was different. It was worldwide. So there was a lot of information out there, some good, some bad, some true, some false. So we had to, funnel through that and educate our clients on the best practices. And I've always been an advocate of prevention. If it's a cold, it could be a cut or anything. But when COVID-19 came into place, it's just put a lot of pressure on us as CHWs to really ask the right questions. A lot of people didn't want to admit they had
Mhm.
the COVID-19.
Mhm.
You had to get testing, you had to go to the doctor. There was tracing. There's all these things happening which invading people's privacy. So we really had to be respectful of that and keep their perspective in line when we're questioning them. And we do ask some pretty intimate questions,
That's true. Mhm.
about their health and their practices and so forth, and that's important. So, like you said, we're still in it. It's not at its peak. I think this is not the last one,
Mhm.
but it's a training ground for CHWs. If something else comes this winter, next year, whatever, I think we'll be better prepared in our toolbox
That's true.
to
That's
to
true.
help our clients navigate through another pandemic, unfortunately.
That's true. Actually, like you say, it has given us that tool to work with, and should this ever happen again, I think we are well equipped, and like before. And again, thank you. I know you've also closed a few COVID-19 pathways, so thank you so much for that.
Yes, thank you. Hopefully I don't have to close anymore.
That's true.
you know, uh,
Someone said our hope is that once we accomplish what we really plan on doing is to get ourselves out of this business. If
yeah,
everybody is healthy, then they don't need us anymore.
right,
So
right,
let's
right.
work ourselves out of business. I know
And
it's easy to say that, but this social issue keep recurring, but at least we're in the right path, on helping people.
exactly.
So before we end, do you have any concluding words or maybe comments you'd like to add, or any word of advice for, community
Mhm.
health workers that are, doing the same work?
Well, I think education is the key. Finding these resources. I know that here in Franklin County, we have um, a, an abundance of resources. However, when we start going to the surrounding counties, I found that I have to do some more research. Licking County, Delaware, etc. They have resources there, and may not be as many as Franklin County, but we have clients obviously from outside of Franklin County, and that's one thing. And then educate yourself. The more training you have, the more exposure to different cultures, that helps. Here at Wellness First, we have different languages, some African language, some Nepali employees here that help us with, people that don't speak English that well. And obviously we have the translator system, which
Mhm.
helps. But when you have one-on-one and someone can speak the same language, there's a synergy there that just starts immediately. That's important. So don't be closed-minded just because you solved the problem last year with 1, 2, 3 resources. There's probably more on top of that. And again, I think that anyone that's in this business and want to help people, as I say, save humanity, because we have to save ourselves. No one else is coming, to save us. Uh, a certified CHW is a good career. It's very rewarding. We all need new CHWs,
Yeah.
because the demand is greater than the soldiers that we have in the field. You know,
That's very true. That's very true.
so just if we can encourage 1 or 2 people to join one of our organizations and mentor them, up to where they're proficient and professional, that's a good thing for society.
It's great. We really appreciate that advice. And I'm sure, with our class keeps, the demand keeps increasing for community health workers training. So the more we train, we hope we can, send them back to the community to deal with those situations. So I would like to thank you for taking time to meet with us again. This was a great interview, and hope you have, enjoy the rest of your day.
Same to you. Thank you, Mary.
Thank you
Appreciate
so
it.
much.